The Iganga Hospital is a general hospital according to Ministry of Health. The general hospital is a hospital that provides basic care in terms of patient management, and we don't do a lot of complicated management of cases in terms of surgery, but we have doctors that are situated at a general hospital that deal with most of the common emergencies.
My name is Amulen Annette. I work here as a nurse on this male ward. This is a male ward. We have 13 surgical patients currently. We have those who had intestinal obstruction. Currently on the ward we have 2. Then those who have undergone a neuropathy, there are 4. Then we have those who, the rest got involved in road traffic accidents.
Annette has worked in Iganga Hospital for over 5 years. During this time, she has had to put up with conditions that put surgical patients at a high risk.
According to the ranking of the hospital, this is a general hospital. So we combine these patients with other cases because this is male ward. We have the surgical, the medical, the urology cases, all are here, tuberculosis, and yet ideally surgical patients, we are supposed to isolate them from other cases. That is a major challenge we are facing currently.
As a professional, she is aware of the risks, but nobody seems to be doing much about it.
The danger of putting together surgical patients with other conditions, there are complications that may arise. For instance, we have a coughing patient on the same ward with a patient who has undergone a surgery. When this patient is recovering post-operatively, can also acquire the cough, which may affect this patient because he's having an incision, and as this patient is also coughing, he can develop a complication whereby the wound can easily burst. If we maintain the infection prevention, someone can heal without giving drugs. But now for our case here, you can see the ward is having open roofs and there are many droppings out there. Dust can come from there and it's going direct to those patients who are having surgical conditions. Water, we have water in this facility, though there are some breakdowns that may occur, but places where ideally we are supposed to carry out our procedures from need some maybe renovation, because you can see those things are broken down.
As a hospital that is located along a highway, Iganga Hospital is the first place where people involved in road accidents end up for the first treatments. It is not acceptable that the hospital still lacks critical equipment to mitigate this need.
We don't have a CT scan, and for obvious reasons, it's very expensive, and I think it's only in our national referral hospital, which is in Lago. The other centers which have CT scans are private centers in Kampala.
Nevertheless, it is critical to appreciate the efforts of women and men working day and night to save lives in Iganga Hospital and in the district. But even then, the state of hospital, which reflects the state of health, is a very worrying trend that calls for action from all who are responsible.